Thank you, Dr. Khaldun, for joining us. Appreciate your time.
Thank you for having me.
I want you to start us off by just characterizing the current status of the state right now when it comes to COVID-19, if you can.
So we are cautiously optimistic. We have seen several weeks now of increases or improvements, I should say, as when it comes to the number of cases and the number of deaths across the entire state. Every region looks a little bit different, but by and large, the state is improving. We're not quite out of the woods yet when it comes to being risk-free, of course, and that will take some time, but we are looking much better.
We started opening up some of the upper parts of the state that haven't seen as much, and then the governor just announcing yesterday that some other aspects, retail, for example, with social distancing and appointments coming online as well. My question for you is also that's this social gatherings of 10 or less, correct?
Correct, across the state. Yes.
That still has to be social distancing. The question I have, it's something that my wife asked me yesterday, is when can we hug our family members again?
Yes, so I also, can't wait to give my family members and my parents hugs again. And so again, I know everyone wants a specific date, and unfortunately, as long as we are still seeing many cases across the state, still seeing deaths, we still know that our testing has to increase significantly. We've made great strides there. Unfortunately, the risk is not zero right now, and so we still are recommending this important social distancing. There's no vaccine, there's no antiviral, and so the best way to prevent the spread is with this social distancing.
It almost sounds to me like you're saying until there is a vaccine that we won't be able to have those kind of interactions with family and friends that we had before COVID.
Well, I think of it as a dial. Well, I don't know if we'll ever get to zero risk. I suspect that COVID-19 will become something like the flu in our community. But again, with the flu, it's not as contagious. There is a vaccine, which many people do get, not enough, but many people do get the vaccine. And then there is actually an antiviral treatment for it. So until we get a better handle on it from a public health perspective, we're going to continue to dial up. I'm not saying no one's going to be able to hug their family members for another year, but we want to make sure there's more immunity in the community and that there's a treatment and it's not as widespread as it currently is.
Dr. Khaldun, the president, just yesterday while he was here and in other recent interviews, has been pushing for the country to reopen with different forms of the argument that we have learned enough about COVID-19 at this point that we know how to prevent it. We know what the safety measures are. Does that argument hold water that we have learned enough about this, the testing has ramped up enough where we can cautiously open things back up?
We are learning more and more every day. I would not say that we know enough about COVID-19 to feel confident that we can just reopen the economy. I heard an analogy from someone the other day that said, when you jump out of an airplane with a parachute on, you don't say, oh, the parachute is slowing me down, let me take it off now, right? You still want to be cautious and be thoughtful and use science and data as you reopen the economy. I know there's some places across the country that have reopened and are seeing increases in cases as they're reopening. And that's not something that you really want to do, is see an increase in the rate of rise of cases and deaths as you reopen. We're still seeing cases and deaths in Michigan, but the rate is slowing. And so that's why we're using that data and science to slowly dial up the economy and watch as cases evolve.
Every day that we post, that we report the numbers, the updates from the state in terms of cases and deaths, inevitably there are comments, emails, calls, social media posts saying that these numbers cannot be trusted. And we get those asterisks of the additional cases. And also that we've seen concerns of people that believe that some of the numbers of the deaths are being inflated, that people didn't actually die from COVID, but are being classified as such. With those asterisks and the additional cases being found, dating back, how can Michiganders know that those numbers can be trusted?
Yeah, I mean, we're using the best data that we have. When it comes to the death reporting, we get death records, death certificates on an ongoing basis. Some entities actually send them to us manually, like snail mail. So when we post it on a daily basis, we take the ones that we got for that previous 24 hours, but then we do our due diligence. And actually, Michigan is one of the top states in the country for death reporting because of that. We go back 3 times a week and actually manually go through death certificates to make sure anyone who had a positive COVID-19 test and died, even though that might not have been listed as the cause of death on their death certificate, we include that. And that is actually the best scientific way to look at deaths related to COVID-19. I could say you can trust the data. We are doing our best to get it reported in to us and then get it back out to the public. But it's a work in progress.
Is there a point where we can say, and then also why can't we say, if we stay on this current trajectory, then at timeline A, B, and C, things can reopen? Because it seems like we're on a trajectory where we're moving into different phases. So how is it that we're not able to come out and vocally say, if we stay on this path, then we can reopen this at this time?
Mm-hmm. Well, the difficult thing about COVID-19 is there is no playbook. We still don't know everything about the disease. And again, I hate to keep using analogies here, but as a physician, you wouldn't go to a physician who only looked at lab tests, never talked to you, never did a physical exam, right? Your doctor, you're not going to have to be on that medication 2 months from now on this specific date. No, they're going to look at the data. They're going to check your blood pressure. They're going to talk to you about how you're feeling. And unfortunately, that's what science is. It is an art. And as much as I would, like anyone else, love to be able to say on a particular date, I know for sure that that business can open, I don't quite know. And I don't want to give people a false impression that there's data that will tell me a specific date. We are looking at data. We're looking at the things that we continue to talk about, rates of rise in cases, rates of deaths, a percent positivity of the tests that are being conducted in a community. But it is an art. It is not an algorithm.
Much like the hugging question, where you said, I don't want to say that it can't be another year, but to a much lesser importance. But when can we see a point in time? Will we not be able to get our own haircuts for the next year? Things of that nature.
I expect that there will be a time, again, as we look at the rate of rise in cases, it will come a point where we are at low enough risk across the state where we can dial up and include things like people getting a haircut. But as of today, we're not quite at that point. But I believe we will get there. We will get there. It's just that we're not there today.
How long do you perceive Michiganders wearing masks for out in public?
It depends. I think wearing masks and social distancing will be a way of life in the state of Michigan and across the country, hopefully for those who are using best practices, probably well into the next calendar year. And again, it depends on the immunity of the community. It depends on whether we have a vaccine and if we can get it to enough of a low level in the community so that we can all be safe to go about.
Is there on the horizon any testing that can have the dual purpose of both testing whether you currently have COVID, but then also testing for those antibodies to see if you have had it in the past in one test?
I'm not aware of one particular test that does both of those. And again, it's similar to a lot of things in medicine. You have a certain test that has a certain characteristic and you use it in that way. For diagnostic purposes, those antibody tests are not to be used. That is very clear from the CDC and other experts. Right now, the antibody tests are good for understanding the broader population, but they should not be used on an individual basis to determine whether or not someone is actually immune to the disease.
And if somebody did get an antibody test and they do have antibodies, does that necessarily mean that they cannot get COVID-19 any longer because they have those antibodies? Or is it too early to say that at this point?
So that's actually a big misperception. I'm glad you asked that question. Unfortunately, the data and the science is not there as far as determining if you have an antibody in your blood, a protein in your blood, if you are actually definitively immune to the disease. There's still much more to be learned there. Even if you are immune, it doesn't tell you for how long. So those are tests that still need to be done. So it's important that if people get these antibody tests, they talk to their clinician and not to use it in the wrong way. They would still, for example, need to quarantine if they've been exposed to someone, and it should not be used in a way to get someone back to work either.
Does the state still need anything federally or need a buildup in any sort of infrastructure to deal with COVID-19? And where do you see a potential second wave happening? Do you see it at this point?
Yeah, well, I certainly hope that we don't see a second wave happening. We do have some models that show if we don't do this social distancing and slow reopening of the economy well, then we will likely see a second wave. And the worse we are, the higher and sooner that second wave will be. We will still need ongoing support from the federal government when it comes to testing and supplies. We will need that into the foreseeable future. And so looking forward to working with them.
There's a lot of talk being made about the president yesterday not wearing a mask and the plant for part of his tour. And we did see a picture that he was wearing one at one point. What is the danger, if any, of not wearing a mask in that kind of setting?
So it's unfortunate that the president was not wearing a mask. It's pretty simple. When you wear a mask in public, you are specifically protecting others from getting the disease if you have it. And that is why we're recommending that when people go out, that they wear a cloth face covering so they can protect others. So that is the public health recommendation, and I recommend it for everyone who's going out into public spaces.
Is that even if you're getting tested on a consistent basis?
That is correct. A test is really only as good as the day you got that test. You could have gotten a test 5 days ago and maybe you didn't have symptoms, you didn't have enough virus in your body for it to be detected, or quite frankly, you could have gotten the disease since your last test. So again, we have to really understand the science behind the test that we're getting, and it should not determine whether or not someone should quarantine if they've been exposed.
Is the danger lessen as we've slowed down and start reopening? It seems like because we've been staying at home so long, we've been wearing the mask, wearing the gloves. Is there a lower chance of getting COVID-19 when we go to the grocery store and things like that than there was 2 months ago?
I would say yes. We think of it as it relates to risk, right? So you can be very, very high risk, which we were 6 weeks ago. And now I would say by and large across the state, we're seeing lower risk, specifically because we're seeing decreases in the rate of rise of cases and deaths. So the risk is not zero, however, and it still exists, and it depends on where you are in the community as far as how much there may be in the community, but the risk still exists.
Dr. Joneigh Khaldun, thank you for your time. I really appreciate it.
Thank you for having me. Stay well.